Well, if you just joined us, you're welcome. You're watching NC Continental Prime, broadcasting live to 54 African countries and beyond. Now, the health authorities in South Africa are on high alert after spikes of malaria cases have been seen in one of the country's regions. The city of Tshwale's health department has warned that safety precautions must be taken when traveling interprovincially. Malaria is only endemic in 3 of South Africa's 9 provinces of Limpopo, Mpumalanga, and KwaZulu-Natal. But according to the statistics in the province of Gauteng, more than 1,000 cases were recorded between January and September this year. At least 11 people died from malaria between January and September also this year. Joining me to discuss this further is the South African National Health Department spokesperson, Dr. Tshwale. Dr. Tshwale, good to see you and thanks for your time. Do tell us the factors responsible for these spiking cases of malaria in your country.
Thank you very much, and thank you to your viewers. There isn't necessarily a spike, because if you look at the numbers that you refer to, are numbers that have been registered in a period of almost 9 months. The official indications that we have are such that there's been a decrease in the number of infections of malaria. If you look at 2021, you would understand that we recorded 5,413 as compared to 5,056 that has been registered for 2022, which means that there's been a decrease of the malaria infection in South Africa in general.
Well, unlike in tropical Africa, where the malaria burden is high, it is hardly spoken about in South Africa. Now, this has got to be part of the challenge in tackling the increase in malaria cases, isn't it?
Yes, it was spoken about because this is the period at which in the health calendar of the region and in South Africa is the period when we remind ourselves about the existence of malaria. So what had happened is that we needed to make an indication of the numbers that we have recorded since the beginning of the year. But the most significant thing is not about the numbers, it's the fact that people need to continuously take caution of the fact that malaria has not necessarily been eliminated, but it's under control. So it's important that we need to continuously raise the issue about malaria as a disease that affects our lives, and sometimes it even causes death.
Now, we understand that the city is calling for safety, talking about the city of Tshwane when traveling interprovincially. Now, help us make sense of the measures that are being put in place to contain the spread.
Yes, the call for the safety is important. Important in the sense that if we have put up measures to contain the spread of malaria, we need to continuously educate our people to know that malaria still exists and they need to take precautions. Part of the things that we are calling people to do is to make sure that at any time when they feel like they have some kind of cold, they need to visit the nearest health facility so that we are able to do the check and screen as to whether the infection is malaria or not. Secondly, that those people who do traveling between countries and even particularly the area, the malaria endemic area, areas, they need to take prophylaxis with them so that they are able to prevent malaria.
Before I let you go, there's been a massive push by the National Health Department to try to eliminate malaria by next year, that's 2023. What are the steps being taken in this direction?
We're working in partnership with the rest of the countries in the region of Southern Africa. There is an initiative called the E8, which is a joint initiative of South Africa, Swaziland, Mozambique, Zambia, and the rest of the other countries in the region which are affected by the malaria. So there are big measures that are taken. Firstly, part of those things is to educate people about malaria, to make them aware about malaria and how it gets to infect them. Secondly, one of the most effective things that has worked for in many years in the region is the spraying of malaria areas, especially now during the period of rains. We do spraying in the areas that are known in South Africa to be malaria prone, in the areas of Pongolo, in the areas of Mpumalanga, and the eastern part of Limpopo. We do malaria spraying, and that spraying, because it contains and eliminates the movement of the mosquitoes. That's the most effective way in which we have been able to eliminate the spread of malaria in South Africa. And that we share with Swaziland and Mozambique to do a huge control over the malaria.
Dr. Tshwale, many thanks for speaking with us.
Thank you.